Welcome back. So this week, ABC 15 is diving deeper into the fentanyl crisis. There is a stark contrast between how the drug is being abused on the streets and how doctors depend on it to help manage pain.
And doctors tell us some pregnant women are benefiting from this drug. Want to bring in our Nohelani Graf. She's taking us inside a Valley Hospital to show the benefits and how future doctors are being trained to handle this.
So when we talk about fentanyl, guys, you're often shown images of pills. That's the street form that cartels started manufacturing. But as medicine, it largely comes in an IV, and it's used in the hospital and never a drug that you're sent home with. Dr. Maria Manriquez wears a lot of hats with her lab coat. She's an OBGYN, an addiction specialist, and a professor for the University of Arizona training the next class of doctors. In each role, she deals with fentanyl.
In a hospital setting, you would use it for pain, analgesia.
Like morphine, fentanyl is one of a few pain relievers that can be administered through an IV, so it's a lifeline in the hospital. The dosing, nothing like what's showing up in street pills.
It's very regulated, and we know exactly what we're giving, and it's not even comparable.
During labor, Dr. Manriquez says new moms who need some relief from the contraction pain but don't want the numbing, sometimes immobilizing effects of an epidural or aren't ready for one yet will get fentanyl through an IV. It works quickly and lasts about an hour.
But no one gets fentanyl going home. They receive something like oxycodone or hydrocodone.
Pills at the root of this epidemic.
Originally, they were not looking for fentanyl on the streets. They thought they were getting Percocet.
Now a deliberate part of the training for her medical residents.
Each and every one of them are getting a full curriculum to have a good knowledge of what they're prescribing, what the consequences are.
The doctors of tomorrow are also sending patients home with far less than the doctors of years past. Arizona law now limiting prescriptions to only 5 days worth of pain meds.
Significant change has been, we used to routinely send patients home with a more than they needed.
That's where she marries her expertise with addiction. However people are falling into fentanyl, she's trying to train future doctors to help pull them out of that addiction.
Providing that non-stigma, compassionate care, which is really important in somebody's recovery.
Now, in the hospital, fentanyl is also used during surgery to sedate patients and suppress pain. It's also used to manage pain for cancer patients, particularly when they've already built up a tolerance to other opioids. And most don't even realize that fentanyl is what they're getting because it's often delivered under another name, Kaylee.
We appreciate you going in depth on this. I know when I was in the hospital back in May for my surgery, they gave me, when I went home, like Tylenol 500. And I thought, oh my goodness, right? It is so easy to get addicted to. You want to feel better when you're in pain. So it's good to know that these physicians are doing what they can to make sure that we're all protected, right? Sometimes we have to protect ourselves.
Right.
So to see our extensive coverage of Arizona's fentanyl crisis and to find a list of resources for anyone struggling with substance abuse, just head abc15.com/in-depth.